My name is Chelsea Bruce, and today we are going to address the topic of racial disparity in the healthcare field. First, we're going to talk about what is racial disparity in the healthcare field is. Racial disparity in healthcare field is when racial or ethnic differences cause a difference in the quality of healthcare given or how the patient feels about the care they were given. There's a story covered by Arkin Beacon Journal about a 37-year-old Ohio black man who described himself as a middle-class homeowner who has full medical coverage and a job managing 2 banks. This 37-year-old had a medical emergency where his uvula was swollen and obstructing his breathing. He first went to urgent care and was given an epinephrine and told to go to the emergency room if they didn't get better. The man's condition did not improve, so he went to the emergency room. First, he was tested for COVID, and the results came back negative. That's when the doctor said that they were going to have to keep him overnight because they didn't want anything bad happening. Then the man started to have a really bad headache. The nurse put the IV and gave him some pain medication to fix the headache. The nurse asked him on a scale of 1 to 10 how bad the headache was, with 10 being worse. The man replied, "It's about a 9, and I've never had a headache like this." The man was in the hospital for 4 days, and on the last day there was a Caucasian male nurse practitioner that came to tell the man that they were discharging him. The man was surprised by this because he still had a headache, but he didn't mind going home. A nurse told the nurse practitioner that the patient wasn't getting any better. The nurse practitioner asked the man, "How bad is your headache on a scale of 1 to 10? The man answered, 9. The nurse then replied, "But it's not a 10. The man said, "It is not a 10 because I'm not screaming for my life." And that is when the nurse practitioner said that he noticed the patient had an IV for pain medication, and he gave a suggestion for Advil. But the man said that he was in a lot of pain, and that's when the nurse practitioner asked him, the patient, "What do you do for a living?" The man said that he was a banker, and the nurse said that "We'll keep you for another day." The man said that he was profiled, and he felt like they were judging him on how real his pain was and if he could actually afford to stay at the hospital. This type of racial bias happens a lot, whether it's implicit, which is an attitude of people that associate stereotypes without conscious known, or explicit, which is when they consciously know this. There was a study done by Journal Pain Medicine where they looked into 20 years of studies of prescribed pain medication. It was found that compared to white patients, black patients were 22% less likely to prescribe pain medication. In an online survey that I created, it was found that when asked if there's been a time where I felt like a doctor dismissed their pain, 70% of Black or African Americans said yes, and 33.37% Hispanics also said yes to this question. Also, when asked the question, I have a family member who's have had a bad experience with a doctor's / and or staff, 7% of Black or African Americans said yes to that question. What can be done to combat this is having programs at medical schools and hospitals that deal with implicit racial bias training. There are already many petitions that are fighting to address this issue. One petition is about to address racism in medical education, and another one is for implicit racial bias training for healthcare professionals. Both of these petitions and others will be linked in the description box below. It's important that the problem is addressed because Black people and other POC groups shouldn't have to worry about their safety in the hands of people that they should trust the most with their health and safety. And also me as a Black woman, I don't want to be worried that if I go into the hospital that my pain will be dismissed and not taken seriously. Thank you for watching.